Welcome, everyone. Good afternoon, greetings, wherever you are online from, welcome. I'm really happy to have you all here today. My name is Nicole E Alvarez, and thank you so much for joining us today for our webinar on introducing the TelePrEP Online Learning Series. I already said this, but my name is Nicole. I use she, her pronouns, and I'm a senior manager on NASTAD's prevention team. And I'm joined by some incredible speakers who I'll introduce shortly. Today's webinar will provide an overview of NASTAD's newly launched TelePrEP Online Learning Series, as well as some upcoming technical assistance opportunities. But the bulk of our session will be spent with the Philadelphia Department of Public Health, who will present on their newly launched TelePrEP program, Philly Keep On Loving. This webinar is scheduled to last for 60 minutes, including time for some questions and answers. So please keep your lines muted to ensure good sound quality. And we'll engage in a question and answer period at the end of the webinar. And if at any point you have questions throughout, please utilize the chat feature and we'll get to those questions. And this meeting will be recorded. It is currently being recorded right now. It will be made available to you along with the slides. And now I'd like to turn it over to Maria E Alvarez with the Centers for Disease Control and Prevention for some brief opening remarks.
Thank you very much, Nicole and NASTAD. Good day, partners. My name is Maria E Alvarez, and on behalf of CDC's Division of HIV Prevention, Program Development and Implementation Branch, I am pleased to welcome you to today's webinar as the Capacity Building and Technical Assistance Lead. Thank you for joining us today. We really appreciate you taking the time out to participate in this special technical assistance opportunity. Today, CDC and NASTAD are super pleased to bring you this special webinar event to introduce the release of NASTAD's new PrEP technical assistance resources, the TelePrEP Online Learning Series. TelePrEP continues to be an effective method to scale up PrEP access and meet the goals of ending the HIV epidemic. As such, through the PS 19-1906A Capacity Building Assistance Portfolio, and in collaboration with CDC's Program Development and Implementation Branch, NASTAD has updated and adapted numerous PrEP-related materials shared during their previous learning collaboratives and developed this TelePrEP Online Learning Series as a self-paced online learning tool now available to health departments, CBOs, and community health centers looking to expand, strengthen, or develop a TelePrEP program. Thank you to all the NASTAD 1906 TA team, especially the PrEP SME Nicole and her PrEP consultants who have worked tirelessly to coordinate this important online work and session. Also, thank you to the wonderful speakers that you're about to listen to from Philly's Department of Health. Philly recently launched their Philly Keep On Loving TelePrEP program at the end of 2022. And that initiative will be highlighted here today. In closing, a quick reminder that CDC's Division of HIV Prevention remains committed to our ongoing partnerships and the provision of quality technical assistance services to support and sustain your local EHE programs and partnerships. If there are any questions for CDC, please submit them to the PS 20-2010@cdc.gov mailbox. Back to you, Nicole, and thank you for your TA leadership on this critical EHE prevent pillar content area. Nicole?
All right, thank you so much, Maria. Really appreciate your support on this initiative and all of the different work that we're doing together. All right, so let's get into it. Just a little outline of what we'll be talking about today. I'm going to share a background of the series, some of the series offerings and format, along with some additional technical assistance opportunities. And then we'll turn it over to the incredible Philly Keep On Loving team, which I'll introduce shortly. And then we'll end with some questions and answers. Before I dive deeper into some of the background of the series, I want to take a moment and introduce some of our amazing TelePrEP Access team. I really believe in teamwork makes the dream work, and this is definitely the dream team. So we have Dr. Brittany Sanders, Cody Schaefer-Fritz, and Ralph Moreno, and they are all part of NASTAD's TelePrEP Access team, and they've developed and produced many of the modules in the learning series, and all three of them are here. So I'll let you all introduce yourself very briefly and share a little bit more about you. I'll invite Brittany to start.
Hi, everyone. I am Brittany Sanders. I'm a nurse practitioner based out of Birmingham, Alabama, and I'm one of the TelePrEP Access consultants. I've been prescribing PrEP for several years, and I've worked with NASTAD developing this TelePrEP program. So I'm looking forward to working with you all.
Thanks, Brittany. And Cody?
Sure. Good afternoon or good day for those of you who it may not be the afternoon. As Nicole said, my name is Cody Schaefer-Fritz, and I am a consultant as part of the TelePrEP Access team. And in other parts of my life, I work in jurisdictional public health programming, where I have a history of building and developing PrEP and TelePrEP and other HIV and hepatitis prevention programs. So very excited to have you all here today to see the work that we have been doing over the last few years.
Thanks,
Wonderful.
Cody.
And I will go last. My name is Ralph Moreno, and my pronouns are he, him, his, based out of Glendale, Arizona. And I've been a consultant with NASTAD for 2 years, a TelePrEP access consultant with NASTAD for that entire time. And it's been a pleasure working with the health departments, working on developing sustainable programs, leveraging 340B, which is the program that I've been supporting for the last 14 years. So really looking forward to this webinar, and I'm looking forward to the feedback and the ongoing technical assistance with the health departments in relation to our learning collaborative. So I'll pass it back to Nicole. Thank you.
Thanks, Ralph. So you all will be seeing a lot of them, a lot of Brittany, Cody, and Ralph throughout the online learning series, along with some other guest presenters. So yeah, really happy to have all of them here, and they've done some great work. So in 2020, NASTAD launched the initial cohort of the TelePrEP Learning Collaborative. You know, as we know, 2020 was a very wild year, and so many programs needed to go back to start leveraging tele-platforms for their HIV prevention programs and services. So in 2020, we launched the TelePrEP Learning Collaborative, which was a virtual learning community for phase 1 and the HIV epidemic jurisdictions that were looking to launch or strengthen a TelePrEP program. After the first cohort of the Learning Collaborative, NASTAD launched cohort 2, and Philadelphia Department of Public Health participated in that cohort. They're successful alums, and you'll hear more about their program shortly. We all know that TelePrEP is here to stay. And so after the second cohort launched, we thought about ways to make all of the resources available so that there would be able to be access from a much larger, wider audience. And so thus the creation of the self-paced TelePrEP Online Learning Series happened. Ultimately, we want the great resources that were developed for a select number of jurisdictions to be widely available to anyone who's interested in TelePrEP. So the learning objectives of the TelePrEP Online Learning Series, by the end of participating, participants will be able to develop, influence, and support the creation of a TelePrEP program's policies and procedures, identify strategies to implement TelePrEP programming within their jurisdiction, evaluate current capacity and identify opportunities to leverage resources to support TelePrEP implementation and or to scale up TelePrEP programming, and then identify additional places to acquire resources or to request peer-to-peer technical assistance. So you might be wondering, who are some prospective participants of the online learning series? And it's available for any health department, community-based organization, or community health center looking to expand, strengthen, or develop a TelePrEP program. Some example participants could be a prevention manager, PrEP navigators, PrEP program coordinators, EHE program coordinators, ultimately anyone interested in learning more about TelePrEP and how TelePrEP can be utilized to expand PrEP access in one's community. So one of the cool things about the online learning series is that folks are able to learn at their own pace. And there are many different topics that will be covered throughout the series. And we've broken it up into 4 different types of sections. So there's an introduction to TelePrEP, tailoring TelePrEP programs, TelePrEP financing, because we got to pay for these things, and then modules that tie everything together. So some examples of topics covered include TelePrEP regulations, TelePrEP delivery models, at-home testing and lab contracts, promotion and education, best practices in engaging youth in PrEP, TelePrEP navigation, equitable approaches to TelePrEP, use of the 340B program, cost analysis, budgeting and scalability, contract pharmacy relationships and interagency partnerships, financial forecasting and sustainability, and then a TelePrEP program operations review and some, gotta love some evaluation at the very end. So some service quality improvement and program evaluation. All this to say, there's a lot of different topics here for a comprehensive TelePrEP program. But let's say your program is looking to increase PrEP in general. Maybe it's not via TelePrEP. A lot of this module, like the content and materials in these modules, like promotion and education, can be really helpful for your PrEP program overall. So the online learning series format, the series is taking place on a platform called Thinkific, and you would make an account and it saves your progress throughout. The topics covered are referred to as modules, and each module includes an executive summary, pre-recorded videos that are no longer than 20 minutes, interactive knowledge checks, supplemental materials, and then a brief evaluation. It also is with a learning series workbook, so you can take notes throughout your time. And then there's going to be supplemental technical assistance opportunities. So we have some live modules out now, very exciting. A couple weeks ago, the first batch was made live. So I have them up here. We have our introduction to the TelePrEP Online Learning Series, which is a lot of the content that I'm going over today right now. We have the overview of state telehealth and telemedicine laws and policies, TelePrEP delivery models, at-home testing and lab contracts, TelePrEP promotion and education, and then we jump to Module 8, which is the use of 340B program for PrEP. So modules can be reviewed in any order, but we do recommend that for financing modules, they go in order. So that's why we have the 340B one there. So when you click on a module, this is kind of what it looks like. This is an example. So it has an outline overview of what's in the module. And we also have the time of each video next to the video, so that way folks are able to prepare their time and day accordingly. And your progress will be saved along with you. So, it's a great opportunity if you have a moment to watch a quick video and see how it can help with your work. So additional modules are upcoming. We will be releasing modules throughout the first half of 2023, which is very exciting. So we'll have more modules available for you in our comprehensive module library. And yeah, before I turn it over to the Philly team, wanted to share and have you all save the date for our first TelePrEP office hour. So this office hour will be spent talking about TelePrEP regulations. A registration link will go out with some of the follow-up materials, and more office hour dates will be announced. So our hope for the online learning series is that folks will be able to review a module and then come into an office hour space to talk about questions they may have about the module specifically, but also a space to field any TelePrEP questions. So we're really looking forward to having an office hour space that's dedicated to TelePrEP conversations, and those will be happening routinely throughout 2023. So with that, we're going to shift gears and hear from members of the Philly Keep On Loving team to hear more about their new TelePrEP program, and want to introduce these incredible speakers. So today we have Brian Hernandez. Brian Hernandez is the telehealth project coordinator for the Department of for for the Philadelphia Department of Public Health. Brian joined the team in 2020 and coordinates several prevention projects such as their HIV self-testing program, the TelePrEP program, and their website, Philly Keep on Loving. Naomi Correa is the program supervisor of the Philadelphia TelePrEP program at Einstein Healthcare Network. She has been providing HIV services with Einstein's Immunodeficiency Center since 2019 and became part of the prevention team in 2022. And with that, take it away. And if you all want to go ahead and share your screen.
Yes, sorry, give me one sec. Okay, can everybody see my screen?
Yes.
All right, awesome. Good afternoon, good morning, hello, everybody. As Nicole mentioned, my name is Brian Hernandez. I'm joined here with my fabulous colleague, Naomi Correa. Today, we are going to be talking to you about the Philadelphia TelePrEP program on Philly Keep on Loving. So for our agenda today, we've broken this presentation down into 5 sections. So first, we're going to talk about how we got here, how we plan things out, how the program works itself, how patients go through the process to receive TelePrEP. We'll go over program updates showing you guys some preliminary data. We'll talk about our successes and challenges, and then what's next for the program. So first, talking about how we got here. So I want to briefly discuss our EHE plan. Why is TelePrEP important? Why is this something we should care about, and creating more programs like this nationwide? So I want to talk about Philly's EHE plan. Our EHE plan is built around 4 pillars, but I want to take a closer look at pillar 3, which is prevent. So under this pillar, we want to prevent new HIV transmissions by using proven interventions, including PrEP and syringe service programs. Our goal for pillar 3 is that by 2025, 50% of people with a PrEP indication will be prescribed PrEP, and 100% of people seeking MPEP will be prescribed treatment. And one strategy to accomplish this goal is by increasing access to low threshold PrEP and PEP for priority populations. So keeping this in mind, implementing a TelePrEP program strongly aligns with our goal for the 3rd pillar. So this is a timeline for the launch of our program. So talks about creating a TelePrEP program here in Philly started way before I myself came to DHH. We really started making big moves when we attended NASTAD's TelePrEP Learning Collaborative. So after we attended the collaborative, 2 months later, we released the TelePrEP RFP. And in the RFP, we explained that the Philadelphia TelePrEP program would be designed and operated with the mission to enable all people eligible for PrEP, regardless of insurance status in Philadelphia, to access PEP through phillykeeponloving.com. The program would also address the PEP uptake among priority populations, such as men who have sex with men, people who inject drugs, transgender women, as well as underserved populations such as Black and Latino cisgender women, as well as uninsured populations. And so Albert Einstein Medical Center was chosen as the funding recipient and began their contract on February 1st. And by October 7th, the TelePrEP program was officially launched. And then on October 18th, we launched our advertising campaign. So Philly Keep on Loving serves as the primary entry point for Philadelphians interested in receiving TelePrEP. With the launch of the program, the website was redesigned to feature TelePrEP and accommodate the patient entry process. So we developed new copy and content that aims to help website visitors understand the benefits of TelePrEP and how it works. One example of new content is our PrEP for Women page, where we aim to inform women on the importance and the benefits of getting on PrEP. So the next few slides I'm going to show you guys are just some screenshots from the website to kind of show you what the redesign has looked like. So when people go to our homepage, what they'll first see right away is this image of the Philly Keep on Learning TelePrep program. So we made sure that when people come to our website, it's the first thing that they see. And so we have brief information here: get prep for free, no in-person anything, discreet delivery, available to anyone in Philly, things like that. This is the screenshot from the TelePrEP landing page. So when folks navigate to the TelePrEP page, this is the first information that they see. Are you ready to start prep? Philly Keep on Learning TelePrEP is just for you. Here, folks have two options to really start their journey. So they can either text prep to this number where they can talk directly with a patient navigator, or if they feel like they don't really have any questions, they know about prep, they're ready to get started, they just want to set up an appointment, we have the option for them to schedule a video call with the doctor. And this is just an example slide to show you some of the new content that we put on the website. So the image on your left is specifically for gearing prep towards women. So here we say prep is recommended for sexually active women, regardless of gender identity or sexual orientation. Kind of like reiterating the message that PrEP can be offered to women, and also expressing that we're local, Philly local, convenient, hassle-free, kind of reiterating the message that this program, no insurance required, no traveling, helping address like possible barriers that people may face when they're trying to access PrEP. And then really quickly, just to show an image of one of our ads. The main goal behind our advertising campaign is to build awareness and trust in the program, resulting in helping motivate patients enrolling into the program. Our ads are featured on plenty of dating apps like Jack, Grindr, and Scruff, Google Display, as well as Facebook and Instagram. And so the image you're seeing here on the left is an example Google Display ad. And here we talk about how it's no in-person anything, 100% free, even without insurance. So there are a lot of moving pieces when it comes to this program. We have several different partnerships to keep this program moving, and I want to explain the purpose of them. So the first one, there's us, DHH, to provide things like funding, practical program support, and local resources. Next, we have Einstein, who are clinical providers. We work with their IT staff to help develop our self-scheduling feature, as well as help us build compatibility into their EHR. We also have Bendujo, which is a New York-based advertising agency who helps with our website redesign and restructuring, advertising efforts, and help coordinate our correspondence with potential patients through Haymarket, which is a web-based application for business text messaging. We also work with University of Pennsylvania as an external evaluator for this program. And we'll quickly hand it off to Naomi to talk about our other two partnerships.
Yeah, so Einstein, when we were approached with this program and we had to form partnerships of our own in order to execute everything, we worked together with several testing lab partners, both to provide the at-home test kits, but also to provide in-person lab options for patients who want that. In particular, we had to form certain accounts with those lab partners to ensure that patients don't get billed. We also work with several 340B pharmacies, particularly Coordinated Care Network and our own Einstein Apothecary. So from here on out, it's going to be me for a little bit. And we wanted to talk a little bit about what we did to prepare for this program and provide more context for the larger timeline that you saw from Brian earlier. So as he mentioned, it took about a year from when they put together the proposal to when we were actually able to launch. I joined that process in February of 2022 when I was established as the program supervisor. And from there, we had several steps to get to where we currently are. Primarily was hiring personnel. That was kind of the long haul struggle for me for a while. We have a couple of personnel, which I'll detail later, but the main three I had to hire were the navigator, our RN, and our patient service representative / administrative coordinator. And so a lot of the struggle with that timeline were the last two, the patient service representative and the nurse, because originally it was supposed to be an LPN position, but we just could not find great candidates. We looked for several months and nothing was really coming. And so when we switched to a full RN, we were able to get a really great candidate and we were able to move forward with that. And same thing kind of happened with the patient service representative. We just weren't seeing good candidates for a long time, but we eventually built a great team. So it's just good to keep in mind that the personnel hiring in the current climate of like seeking employees may be a difficult thing for your program to overcome. We also had to write several policies and workflows, mainly because we were fitting into a pre-existing clinic. So we are part of Einstein's established immunodeficiency center within their outpatient clinic. And so we had to ensure that our policies worked within that context. Also, we work with a lot of residents, and those residents change out on an 8-week basis. So we need to make sure that any new people who are coming in and seeing our patients for the first time know exactly what's going on, and our staff is able to support them properly. We also contracted with the testing vendor for the at-home lab kits, and that was a huge hurdle that did not even get resolved until this January of 2023. A lot of things contributed to that. Part of it was that Einstein was getting acquired by Jefferson's medical system here in Philly. And so that changed the system with which we contract vendors. And another part of it was that the vendor we were working with had some other struggles on their own. Part of it might have been the holiday season, but yes, we didn't get access to our lab kits until January. So expecting some delays with that process would also be a good idea. We had to modify our electronic health record because we were dealing with this outside lab vendor. Those results would not automatically upload into our system. So we needed to create a system for those results to get handed off as quickly as possible. So we do have that now. We have a form that we've built. Our RN takes the results from the portal where we get them from the lab vendor and puts them directly into our chart. We also had to build some new schedules in order to make the self-scheduling feature work. Einstein already had access to self-scheduling through a company called Kairos, which communicates with our health record. And so we just had to build like new slots and new resources to connect to that system. So that involved like negotiating with our resident team to see what hours we could use. We also talked to other providers in Einstein, including our teen clinic and our Logan Plaza providers. So all of their schedules got involved in creating these new resources to allow for self-scheduling. Speaking of residents, we also had to train a lot of them. We were a part of their summer series in September, where our medical director, Dr. Safa, trained all of the residents at once in PrEP care and how TelePrEP would work. We are continuing to train them every 2 weeks for a cohort. I go and talk to the residents specifically to make sure they know what the program structure is and who they can go to for assistance. But as they continue to rotate, we'll continue doing that training. The last is the research and data collection. That involved both setting up our own internal methods for data collection and working with the Penn team to determine what external evaluation would look like, working with the Department of Health to see what they would want from us in terms of their external evaluation. And so we feel that we've done a pretty good job at creating data management systems that work. We have several spreadsheets to coordinate all of our care. We use the CareWare system for inputting a lot of other data. And we're currently working with Penn to figure out what the best way is to do surveys to collect patient response data about their experience in the program. So we are also working with the IRB for ourselves and Penn to make sure that that is all done well and patient consents are collected correctly. So that is kind of a pseudo partner for our program, is the IRBs for all of the research that we do. I think go for the next slide, Brian. Right, so discussing personnel and the full TelePrEP team. So currently we have 5 staff, not including myself, that are all involved in different ways. So we have our patient navigator, whose main role is to outreach to patients within 8 business hours of however they contact our program. So that could be 8 hours from when they self-schedule, from when they text the number that you mentioned, and also when we previously had a chat feature responding to those chats. He assists with program navigation in general. So if there are concerns about medication cost or insurance, or the patient might need another referral to an outside system, like if they need mental health assistance, those general navigation duties, and ancillary services. Our RN, the main role for that position is placing the orders for the lab kits, coordinating in-person labs, that is the bulk of what can keep people from getting their prescription, because our medical visits are televisits. So those are usually pretty easy to follow up on. The RN role also is really great for administering injectable PrEP. And so we are able to provide it at our clinic. And because we have a dedicated staff person, we don't have to rely on the clinic to provide those injections, and that may cause delays. The RN also follows up on medication initiation, so making sure that there are no side effects, that the patient is doing well with their medication. Our patient service representative and admin coordinator mainly is for registering patients for their televisits. This also ensures speed because our front desk for the regular in-person clinic can get a little bit busy. So having a dedicated person for that is very helpful. The PSR and admin also checks insurance, assist with grant management for patient bills. So if a patient ever does get a bill, making sure it gets directed to our grant funding instead, and has been assisting with documentation and careware because they have so much access to the insurance information, addresses, etc. We do have a piece of time from a CQI coordinator whose main role is to review our careware data, submit it, and ensure that our data is as clean as possible. And we have several medical provider staff that we interact with, mostly the residents supervised by our medical director, Dr. Safa. We also have 2 other locations, as I mentioned, our teen clinic and our Logan Plaza residents. We are also hiring a new medical provider soon who will be dedicating weekend and evening time to our programs. That way we can offer those expanded hours. Okay, and we're gonna dig into a little bit of how it works for the patient. Hold on, I'm gonna take a little bit of a drink because I don't want to be coughing for all of you. So we have 2 kind of different patient journeys for oral PrEP and injectable PrEP. And mainly that has to do with what order the labs come in and what order the taking of the medication comes in. So for all patients, the number 1 step is awareness. So ads are run by Banduho to direct patients to the PKOL website. Oh, sorry, 1 second. Okay, sorry about that. So once they reach the PKOL website, they can connect with the program by speaking to our navigator through that phone number or by directly self-scheduling their first appointment. For us, we view this as an accessibility measure. A lot of people either don't want to talk to somebody right away, or that might be seen as a barrier to getting their medical care as fast as possible. From there, to get their first script, they need to complete 2 steps: completing their telehealth visit with one of our providers and completing their labs, either with the kit that's mailed directly to their home or in person. And then once those are both completed, their script is sent to the pharmacy by the provider. The pharmacy, they can choose, but we do let them know that we have the ability to mail it directly to their home through our 340B partners. They can also come pick them up at Einstein or whatever local pharmacy they prefer. And then from there on, we focus on maintenance. So this process gets somewhat repeated on an every 3-month basis. Next slide. For injectable PrEP, the first couple of steps are very similar up until they talk to our navigator or schedule their appointment. From there, to get their first script, they have to complete their telehealth visit. And then from there, our RN, Jahani, will reach out to begin the prior authorization process. So we hold off on the labs until we know that the patient can be approved for the injection. Normally they do. We haven't seen too many problems with that. And then once both of those steps have been completed, the prior authorization is a success. Then the script is sent to the pharmacy and the patient can schedule an appointment to come in for their labs and injection at the same time. So we do a point of care HIV test. We also draw the labs for the follow-up viral load HIV test, but they can just get their injection that day and not have to like wait for labs to go through the process. And yeah, now we're shifting program updates. So in terms of how did all this go? Like we established this system, we established our steps and protocols and these relationships with our partners. And so this data is from through January 31st of this year. So as of January 31st, we have a total of 296 patient outreaches. So those are patients who have interacted with our program by chat, text requests, self-schedule, internal referral, or external referral. And then from those patients, we consider enrolled patients anyone who has scheduled their appointment, because at that point, they're being followed by our navigator. So of those people who were outreached, 36 of them are considered enrolled. From there, they become active once they have completed their visit, labs, or both. This means that our nurse is following them to ensure they complete both steps in the process, but we do want to differentiate between people who have scheduled and maybe missed or canceled their appointment versus people who have completed a step. From there, we have PrEP scripts. This is indicating people who completed both steps and their script was sent by the doctor to the pharmacy. So that's 24 people. So there's a big difference between the people who outreach all the way down to actually completing both steps. And we're trying to bridge that gap a little bit. And the final step is initiating their PrEP. So they got their script, they're actually taking their medicine, or they actually got their injection. And as of the end of January, we had 19 successful PrEP starts, or initiations, I mean. Okay, you can go to the next slide. So we also kept some data on which outreach methods were more preferred and what our patient demographics are currently looking like. So over the course of the months that we have data for, the self-schedule was the lowest utilized resource. A part of that might be that it was just kind of limited the amount of slots that we had in the beginning. So we're hoping to prioritize that and see an increase in that this year. Chats and text requests were kind of equaled out for a bit. We had to stop the chat, which we'll talk about in our challenges. And so things leaned more in the text request direction as of January. And then for demographics, we have seen that predominantly our patients have been non-Hispanic, Black, and white. Though we have seen some uptick in patients of color as we've been outreaching more and shifting the ads a little bit. In terms of gender and sexuality, 80% of our population is currently cis male, and 50% of our patients have MSM as their PrEP risk factor. So while the ads are, and our general messaging and ads have been prioritizing that, women are encouraged to take PrEP, it's accessible for women. They're only about 14% of our population at the moment. In terms of age, our biggest age group is 25 to 34, which I think is a good success. I think that is a large demographic that we are targeting for PrEP. Aside from them, 15 to 24 and 35 to 44 are the largest groups as well. So we are seeing good results in terms of the age demographics we're looking for.
Alrighty, thank you so much, Naomi. So now we can move on to talking about our successes and our challenges. So there have been many successes with this program so far. One thing that I like to take pride in is that we were able to launch a program within 1 year of completing NASTAD's TelePrEP Learning Collaborative. I believe that accomplishment does come from our utilization of NASTAD's technical assistance expertise. It can be scary to reach out for help when developing a new program, but NASTAD's TA helped us hit the ground running. Just want to give a shout out to both Ralph Moreno for educating us on 340B, as well as Cody Schaefer from our TA meetings, giving us insight into how Iowa's program works and how it's been effective. And another factor into this accomplishment has been the fact that we've been very intentional with our program planning. By this, I mean that we made sure that all meetings we have mattered, but we know that not every meeting is for everyone. Every meeting to us has mattered. And we have all kinds of meetings, weekly, bi-weekly, monthly. Everyone working on this program has had the intention of ensuring everyone is on the same page and informed on all of the moving parts. These meetings have really helped us maintain momentum, ensure clear communication, stay on track, and establish stronger relationships with each other. Another success that we've seen is that our advertising campaign has showed to be effective at increasing website traffic to Philly Keep on Loving. Folks see our ads, they go to our website, they're interacting with not only our TelePrEP program, but our other programs as well. So indirectly, because of our advertising for TelePrEP, we've also seen an uptick in the use of our other prevention programs, like our HIV self-testing program and our PEP hotline. One challenge that we experienced has been with our chat operations. Something that we didn't anticipate was that when we launched the chat, people would use it to inquire about other services. So while this chat is mainly for the TelePrEP program, folks have utilized it in other ways to inquire about STI testing, HIV testing, or people just have general sexual wellness concerns. Another challenge has been advertising as our main funnel of patient enrollment. When we learned about the issues that were arising from the chat, we made the decision to temporarily pause our ads while we reassess a new strategy for the chat. However, in doing this, we did experience a significant drop in patient outreach and enrollment. Our ads are back on, and folks still have the option to text us while we reassess our chat operations. Naomi, you want to make a comment on these two challenges?
Yes. So one challenge has been, as I mentioned, self-scheduling was pretty underutilized by patients, and the feature itself required new structures to be built into our scheduling software. So essentially the struggle is we have 3 different kind of buckets in which our appointments live. So we have our main clinic, we have the teen clinic, and we have the Logan Plaza clinic. So all of those providers have given some of their time to our program, but because they're different locations, it's difficult to show all of those slots to patients in a really concise way. So we've been back and forth with our IT trying to figure that out. And so we are still working on a solution for incorporating those, but it has been a struggle. And also the delays I mentioned in contracting with the testing vendor. Like I said, I think it was just in both of our ends, just some of the bureaucratic nature of the contracting process, but it has been resolved.
So what is next for our program? So there's a few things that we are prioritizing. One, restructuring the self-scheduling feature to increase patient enrollment, really trying to figure out how can we make more slots available, specifically how can we make them more available for folks to see on the website. We do want to hire additional staff for our chat operations. So initially, our patient navigator was taking care of all of the other inquiries regarding STI testing, HIV testing, but that can be burdensome. So we do plan to hire additional staff that can manage just the chat operations and handle any other inquiries that come in regarding our website. We also still will be developing new wireframes for Philly Keep on Loving. So always rethinking and re-strategizing new ways to keep people engaged with the content on the website, what they're looking at right away, and making sure that people, it stays fresh and it's changing. And lastly, continuing to assess our advertising efforts and identify new ways to increase awareness. But that is the end of the presentation. I'm going to go ahead and stop sharing.
All right. Thank you so much, Brian and Naomi. That was an incredible presentation. I'm going to remove y'all's pin. Hold on one second. Boom. And I will share my screen in just a moment, but we do have some questions here in the chat. I know that they've been answered already by Javante, another amazing Philly Keep on Loving individual, but wanted to see if there were other questions that folks had. And I have a couple of questions myself.
And while waiting for those, I do want to provide a little bit of clarifying information on some of those questions that Javante answered, which he did great. I just wanted to add a little bit of extra information. So how often we're testing for STIs? Yes, we are testing every 3 months. For aptitude, we're testing every 2 months at the moment, though that may shift based on the guidelines for aptitude as they come out. In terms of the reason for the gap between outreaches and starting PrEP, it was a little bit due to how we were measuring things before when the chat was operational. But because we now know more about the chats and like whether they were effective measure or not, and whether they should be counted as patient outreaches or not, that's why we are shifting things a little bit this year and hiring those additional staff so we can have a better look at an accurate patient continuum. And for STI treatment follow-up, yes, we do provide STI treatment follow-up. Especially we've had to focus on syphilis because the testing for syphilis is difficult with the lab kits. So we make sure we follow up with that in clinic. And that is also one thing that differentiates from a lot of private competitors to the TelePrEP program, is that a lot of those private competitors don't do well with STI follow-up.
Awesome, thank you. And there was another question that's been in the chat. What is the lab kit sent out? So you all utilize molecular testing labs, and then it was just answered, a dried blood spot test kit. Are you using 340B revenue to assist in lab cost?
So yeah, to address the first question, yeah, it is a dry blood spot test. It also comes with swabs for urine and oral and anal collection as well. And then the lab costs, it depends on what lab we're working with. So if it is in person, then we use the patient's insurance as like the first resort. And then if they have a copay, then that'll get directed to our 340B funding. If we're working with the lab kit company, MTL, then all the bills go directly to us. Like the patient's insurance is still run, but the patient never sees the bill. We're able to direct it directly to us, and specifically to the 340B pool of money that we have, like our special account for that, our special purpose fund. That is the phrase.
And I want to clarify, good afternoon, everyone. I'm the silent partner for an amazing team of Brian and Naomi. My name is Javante. I'm the prevention program manager in Philadelphia. But we specified in our RFP that the 340B funds had to be redirected to the program that was generating the revenue or the cost savings, because we are finding that a lot of providers will just kind of allow the money to trickle up into more of a multi-purpose general fund. And it was really important to us that while we were providing the initial investment into this program, that those 340B dollars be reinvested into the program so that it would become essentially revenue neutral. One of the things that we know is that if we're not advertising this program, it won't be successful. Like, it's a clinic in the sky, essentially. So you always have to be running ads. And so what we envision in the future is that the health department will be a partner in advertising, and that the program can grow to a patient panel that will be self-sustaining through 340B cost sharing. Now, what the future looks like for that politically, it's uncertain, but that's our vision and goal for the next few years of the program.
Thanks, Javante. Now there's a question about uninsured individuals using the TelePrEP program, and do they have to pay any monies?
So for uninsured individuals, the short answer is no, they don't have to pay anything. It depends on which cost we're talking about. For the medical visit, that is directed to our 340B funding, and that is done directly, like, by ourselves, like by Einstein. For medication costs, we do go through medication assistance programs first, namely because the medications are quite expensive. One thing we're also working on is a partnership with our 340B pharmacies, CCN, in order to provide low-cost generic Truvada if someone doesn't fit into like the medication assistance criteria. So if for some reason it is not working out, like if they make too much money or something like that, then we do work with the partner pharmacy to provide as low of a cost medication, and then we still cover it ourselves. It just makes it so we can actually sustainably cover medication for patients, because if we just had to cover like Apretude with our 340B funding for one person every year, like it would be far too expensive for us to maintain.
Excuse me, this is Ralph. Can I just make a comment on that in regards to the 340B? Because I think it's a very important point. And strategically, as we know, 340B money is used as sort of a trickle down to provide various forms of subsidized care. But there is also the optimizing and actually making best use of the money. So I want to compliment Philly for developing policies that sort of develop a rule logic to actually make sure that they're making best use of the money and making it go as far as it can. So it's not just about making the money useful, but it's actually making it go as far as it can. So kudos to you on that. And I think it's a very important point. So.
Any other questions that folks have? Either if you want to put them in the chat or unmute yourself. I do have a question. My question, you all have, like, putting together a program is quite a thing, right? I'm wondering, now that you all are on the other side in implementation phase, like looking back over the last year, what is something that you all are the most proud of about your program, or just what are you most proud of at this point? And y'all are in the implementation side, Javante, between getting everything on the pre-loaded side, you all are in the implementation.
I question, are we on the other side? Because there's so many things that we're still learning in terms of, oh, this thing broke and this thing needs to be fixed. And people are engaging with chat in very interesting ways. They're not just wanting to streamline and make an appointment. They have questions about their sexual wellness. And so we need to staff people who are almost like testing and linkage counselors to run the chat. So, as those things come up, we continue to learn and optimize. But I think if I could just take a moment of personal privilege, I'm proudest of three things. The first is that we were able to do this. This is my favorite part of public health work, where you can dream up a program, receive institutional support and resources, and then make it come to life. And I think that's why a lot of people go into public health, for that idealism and this ability to see a tangible impact and a difference. And so this program has really shown our team that it is possible to bring new ideas and implement them in a way that our city needs. The second thing is, it's really hard to design something that's low threshold. You have to think about every piece, right? Like the scheduling. There's so many moving pieces of making weekend and evening appointments available. There's so many things to making something quote unquote free, and a lot of policy changes. Sometimes laws have to be changed. So low threshold is not as easy for the provider as it should be for the patient. And you take on a really big burden to make something low threshold. And the fact that this program is low threshold, I'm really, really proud of that. And the third thing is that I'm really proud of Brian and Naomi. Like, they caught the vision for this program, and Brian, on the inside of our health department, and Naomi leading at Einstein, they've really inspired a lot of hope for the future of public health, because they're both a little bit younger than me. It just makes me really proud to work with such a team that's committed to innovation and to have meaningful arguments about, I think it should be done like this. No, I think it should be done like that. That means that people have ideas and passion, and they're committed to the work. So I would highlight those three things as like my personal favorites from the last year. I don't know, Brian, what would you say?
I mean, you touched on some really great points. I think the thing that I always think about is, we officially launched in October, and just the year prior, we had just ended attending the Learning Collaborative. So for us, we really hit the ground running. When we started the collaborative, throughout the whole thing, Javante and I, we were making preparation steps for everything from writing the RFP to figuring out what the process would look like what is the patient journey. And then also, I think so that's something that I'm very proud of, and I take pride in with that. Though we do have there's things that are still constantly coming up that we have to adjust. But quality improvement is important. And I think another thing is This program is the first program that I've started that helped start from the ground up as a project coordinator. So this is like my first time really doing this, so I've always wanted to ensure that everybody knows what's going on. Everybody has the updates. People have the meeting minutes. Everybody is invited to any meeting that they need to be invited to. And so it is about having that intentionality. I want to make sure that I can, as a project coordinator, like help set the standards for us as the Division of HIV Health, as well as also advocate for Einstein when there are things that they need, and help communicate that to leadership. So those are the two things I would say for me.
Yeah, I think for me, kind of like being on the ground with it and with these lovely staff that we've been able to collect, I think the thing that I'm most proud of is the little bits of patient feedback we've already been able to get. Like I mentioned, we don't have a lot of enrolled patients at the moment. I think now, as of the end of February, we're closer to 50 enrolled patients, but we've gotten amazing feedback. Like, I'm comfortable here. I don't want to go to another place. Like they've been with it, been through us with it in terms of like not having the lab kits yet, and they still stuck around. And ultimately our patients are having a good experience. And that is what I'm really proud of, is that we were actually able to get it off the ground and have an actual program that runs, and we're putting PrEP into the hands of people, and we're still growing and developing. But even if we don't succeed right away, like the fact that we got PrEP into the hands of as many people as we have is going to be a win for me forever. So
what advice would you give to some of our other jurisdictions about implementing a TelePrEP program?
Do you want to take that one, Brian?
I will lean on Javante for this, but I think one thing that is important is helping provide technical assistance to providers. Sometimes I tend to think I work in a silo at times. And so I assume so many more people know about PrEP, and especially providers, but that may not be the case, and so something that we at DHH offer is technical assistance. I'm part of the technical assistance team where we have quarterly PrEP provider meetings where we talk about any surveys that we're doing at the health department, any new information in terms of like policy updates or new resources that come out, and really trying to promote and increase awareness about PrEP, so that when people learn about these things and they have questions, they can feel like compelled to reach out to us and be like, how do you guys do it? How are you guys getting started? Like, what is something that we could do? What resources do you have? And it's very fulfilling when folks do reach out about questions about PrEP, and that you're like the source for people to go to get that information.
I would say build your partnerships fast and deep. You saw the slide with all the different players and organizations and vendors. Like, it's going to take a team of people with different expertise across industry, across disciplines, like something like this that is easy to just log on to the website. Going back to my earlier comment, low threshold isn't always low threshold for the provider. And so you need to be intentional about your partnerships, and also make sure that you're building those relationships deep and that they can be resourceful to the program overall. And also, I dropped my email in the chat. I'm happy to be a resource. All of our emails at the health department are our first name, last name @phila.gov. So you can feel free to reach out to myself or Brian, Naomi. I would invite you to drop your contact in the chat, and we're happy to answer any questions. But definitely partnership is key for a program to be successful.
Thank you so much for answering all these questions, but also just sharing the wisdom that you all have gained from doing this program and your launching efforts. And just, can we get another round of applause, snaps, reactions, party horns, all of the things for Philly, because y'all are doing amazing work. So thank you so much. So I know that we are at time, but just wanted to share some contact information and next steps. So Krupa has already added some links to the chat. Thank you so much, Krupa. But yeah, join the TelePrEP Online Learning Series, create an account and start a module, get started. If at any point you have questions about TelePrEP or PrEP and want to get connected to one of our amazing team members on the TelePrEP Access team, feel free to reach out to us at prep@nastad.org. Krupa also put in a link for our PrEP Access listserv or newsletter. So feel free to join that too. We'll be sending out more information about office hours and updates on the TelePrEP Online Learning Series. And yeah, thank you all so much again. This has been recorded. The slides will be sent to you as well as a registration link for our first office hour. And yeah, I hope you all have a magical rest of your day. And thank you so much for joining us this afternoon or wherever this time frame. Have a good one, y'all. And